So there aren't any panelists in the waiting room. I think if everyone's okay, we'll probably get started because we're about 6 past. All right, so first, good morning, and thank you everybody for hopping on the call today. I'm Jessica Gorton. I'm the waiver manager here at the Bureau of Developmental Services, and Sandy Hunt is also here to join us. And for technical side, we have Alicia, who helps us in numerous ways, and today she's going to be providing some tech support, taking her minutes. And Maureen is also here, Maureen DiTomaso, who also helps us in ways that I can't even list off right now. She's just a huge support for our group and for our bureau as well. So I'm going to hop into our presentation for today. This is our 3rd meeting. Hard to believe it. The year is almost over. Our next meeting will be in the new year. So our goals for today's meeting really is going to be around the assignment from the previous month to develop a common group understanding about what the services our group has identified as being of interest, services that we'd like to explore, and also how we all align those services between the 2 waivers, which are appropriate for the comp waiver, for the supports waiver, and for both. And then the one other area that we wanted to explore that came out of the last work group was a survey and outreach plan for innovative solutions that were that came about during COVID-19 and the public health emergency. As always, this waiver work group is open to the public. Members of the public who are not on the waiver work group can listen to the group's discussions, but will not be able to ask questions or participate in discussions occurring between group members. This structure ensures that BDS can engage a diverse group of stakeholders in substantive dialogue while also providing transparency and general updates to the public. If you are a member of the public, however, and have questions about the waiver work group and or its work, please contact us at BDS Waiver Structure Workgroup at dhhs.nh.gov, and we will respond as soon as possible. And on that note about the work group, so there we had the email. We had a couple of technical issues, but your homework was received if you sent it in, even if you didn't get a response back. Just a quick disclaimer there that there were a couple technical issues. So our agenda for today, as mentioned, is going to be review and discuss our assignment from last week, our service review, our state and other waiver services in other states. And then to discuss the survey outreach. We'll talk next steps quick and then go over any questions that we might have. Okay, any questions before we jump in? All right, here we go. Okay, so the first thing that we wanted to provide was some general feedback and some common feedback that we saw as a result. So this assignment, as I'm sure you guys all recall, was large. There were about 90 services that we reviewed, services from New Hampshire, and as I mentioned, other states. And really our task was to go through each of those and think about, is this something that we'd like to explore in New Hampshire? And if so, which waiver would it be most appropriate under, or both? Or is it a service that we wouldn't choose to explore in New Hampshire? So some common feedback included or was around service definitions and flexibility. Participants expressed a need to prioritize service definitions based on observed need within the community. Services for seniors, this was really common. This was a really common response. It was seen and identified as a critical need in New Hampshire, as well as dental services. There were a few requests for clarification. Some respondents asked for clarification about things like billing units. What does the service mean? Not necessarily the definition, because that was included on the worksheet, but what does this mean? And how to think about services that seem to overlap with others. And then workforce capabilities and service definitions. Some respondents noted that some services, such as peer supports, might be considered capabilities of workforce providing other services, rather than as a unique service offering in and of itself. So down below here, you'll see some of the comments were captured, really that we used to compile this bulleted list up above. Anybody have any additional input or comments to offer on some of this common feedback that we received? Maybe around services for seniors or individuals who are aging, dental, or especially around the request for clarification. Please don't be shy to raise your hand if there was something in there and you're like, what is this saying here?
I'm just glad to see that a lot of my comments were pretty much the same as everybody else's, because I was like, am I doing this right? But yeah, I'm glad to see that I had most of this in some of my feedback too. So that's nice to know we're all sort of thinking on the same page.
I felt the same way, Renee. Like, oh, okay, this is what the group's saying as well. Krista, did you ever find out?
So I had a question, and maybe for me it's a lack of familiarity with some of the language as a family member, but it seemed like there were a lot of options for like peer support and a lot of just different options for different individuals to be providing support. And last time we were talking about you know, looking at DSP credentialing and maybe the state moving towards that. And so if that's something that the state is considering, I'm wondering about expanding roles for other people in different positions. You know, why, like, what would that look like? And why are all those other roles being identified and considered to be included in these waivers?
I think that's really important feedback as well as we move into this work and certainly start talking about what are our opportunities, especially around credentialing and provider qualifications. And whatever we build within the waiver for qualifications will necessarily require some state administrative rule updates. So that would be our opportunity to start looking at all of those credentialing requirements, criteria, training, things like that, and see, does it align with what our goal is, what we think is best for health and safety of individuals, certainly in ensuring that services are provided by folks and individuals who are qualified to provide them. And what does that look like? What does qualified to provide mean within each of the services? Is it slightly different depending on what the service definition might be? And excuse me, folks, I'm kind of just getting over a cold. So if my voice drops off and on, that's what's going on. I think that's a really important point to capture as well. Does anybody else have any feedback on that? Because I think in the back of my mind, I know we're going to talk about credentialing and things like that and what that looks like nationally, but I'm keeping in the back of my mind as we go through all of these services, you know, what would the provider qualifications look like? Does it align with what we currently have in various places? I mean, certainly if a requirement is built into law, we might not be able to move the needle on that, nor may there be a desire for us to do it. But in other areas, just kind of for my own edification as we go through this, really, what would that look like? Would that be a change? Would the current rules and excuse me, statutes support maybe a slightly different definition of what a requirement is for provider qualifications, et cetera?
I feel like that was a really long question. Can you clarify that a little bit? Are you wanting more feedback on DSP? What we're looking for in terms of a DSP credentialing, or are you asking for more feedback on concern about different roles for all those different things that were listed in the homework?
So for now, as we go through, I mean, there were 90 services in this particular assignment. And as we start to really focus and hone the services that we would like to include on our waivers in New Hampshire, maybe for now, just in the back of our minds to consider what would those qualifications look like? What do we, where we have the opportunity to update, change, and rewrite provider qualifications, what might that look like? So it's kind of hard to say now because what we're looking at are definitions from other states largely, and we could choose to keep some of those definitions as they are, but we might also have the opportunity to tailor them a bit more for New Hampshire's purposes. And provider qualifications is also an aspect that we can tailor within the waiver. So more of a point for consideration and kind of just keep it in the back of our minds as we go through this work.
Okay.
But certainly if anybody in the group has any thoughts on that in the here and now, please feel free to share it now, especially if there are specific components, as I'm saying, or suggesting that we all keep that in the back of our minds. If there's something that's pressing that everyone's thinking of right now, please go forth, say it, and we can capture it in the notes for the group so that when we get to provider qualifications and we start building that portion of it out and discussing that, we can make sure that we have that captured. Okay. So I'm going to go to the next slide. I don't see anyone else's hand up, but please just speak up if you want to contribute or share. Okay, so of the 90 services, there were some that the group said would be distinct comprehensive waiver services, and about 9 that were identified as support waiver services. So a few discussion questions just as we try to understand. I mean, there was an opportunity to provide notes on the assignment, but really just diving into some of that a little bit more. Multiple respondents identified assisted living as an important service to include. And, how can the system support improved capacity for this service? Some respondents also indicated that legal challenges have limited the implementation of services like living caregiver or living companion. What other statutory or regulatory barriers have existed in implementing some services that are currently available? That information will be helpful, similar to provider qualifications as we start to think about those. Is there an opportunity or a necessity to update things within our ability as we provide and build out additional services or new services? And then how does the group think PDMS fits into this exercise to service identification by waiver? And, a broader discussion does PDMS as a modality, not as a service. Does that go to both waivers? Does it go to one waiver? What is the group thinking about PDMS? And then would the group like to comment on the usefulness of including things like supports for unpaid caregivers as a support service offered within our waivers? So a lot of questions there, but really just the hope is that people will offer any input they have on any of these areas. Any thoughts on PDMS?
Yeah, oh. Jess, I did comment on the assisted living. In reading the description, it appears to be similar to a model that New Hampshire is looking to have vendors develop right now, sort of an apartment model, with individual caregivers that can support people with their ADLs and whatnot, sort of a step down from shared living. So, I thought that was important to start to consider now. Because we don't provide it, I think we'd have to sort of build that out and figure out, is that a companion model or do you use shared living providers? So more of a comment at this point, but we're working through that right now as well. Sorry, I'm getting over a cold.
Crystal, go ahead.
So just as a family member and in talking with other families, I have concern over the assisted living model and really wanting family members and individuals wanting to stay in the community and in their own homes, and feeling like if we had adequate supports in the community, there would not be a push towards assisted living for individuals with disabilities. So Just sharing that there's a concern.
Definitely, yeah. And this seems to be, you know, when we talk about the service categories as well, because I think in seeing some of the feedback, some folks were looking at assisted living more similar to continuous residential supports. And we saw that service category, which is kind of similar to what Jen was just describing, versus Krista, I hear what you're saying as well, assisted living also, because that's the title of a service, or, you know, the, I'll call it the common title of a service in the CFI waiver. For an individual who might be living in a residential setting that is specific. So I agree with both comments, and definitely as we move forward, this is where choosing service category titles can be very important, I think, so as not to appear that we're moving to a service that's maybe not what our state is, how our state feels community-based services should be provided. But definitely look at other support options where, Jen, to your point, an individual is living in the community, maybe with supports close by or nearby. And how could we build that out in New Hampshire?
Yeah, I really don't like the name assisted living. I think I had in my notes too. So I do think renaming those would be key.
Definitely. Thank you for that feedback. Does anyone else have any? Oh, Renee, please. Oh, I see hands. Sorry. I see over here.
Pam had her hand up first, and then Jen. So I'll let them go first, and then I'll go.
Thanks, Renee. I think I just wanted to say I agree with both Jen and Krista. I think the assisted living, the title it throws it really off, because when you think of assisted living, you think it's before the nursing home, that type of thing, and it really throws off. So when you're describing it, it was helpful when Krista described what she was talking about, and when Jen described, I think we need both of those, and there's a real need for both of those in many situations we have. So I think we really do have to look at that title and really kind of take a look at whether it's it can mean a number of things, I think. And the other thing that I wanted to mention, I don't know whether you were talking about looking at all of these at once and stuff, but just so I don't forget the PDMS, I wanted to say that that really should be both waivers. Looking at it, because you've got some PDMS where it's minimal supports, but enough so that the family, they can do what is needed. But then you have some that are pretty heavy duty, but the family is still involved and everything. So I think it can meet both of those waivers, and so I think we should look at that.
That's great feedback. Thank you.
I can speak a little bit to the challenges with live-in caregiver companion models. At least from our experience, we had to shift models with our companion models probably about 5 or 6 years ago, related to Department of Labor rules around overtime. So I think if we were going to bring that service back, it would be really important to have some conversations with DOL to figure out, how do we compensate those caregivers? Because, you're essentially paying for a 24/7 service, and making sure that that's all above board. We shifted more to the enhanced family care, which is a stipend model versus an hourly wage. But that was kind of the confusing part of that service for us. So I think that's where we would need to explore a little bit more before bringing that service back online. And sorry, I just realized I jumped queue with people who had hands up. So apologies.
Oh, thank you, Sarah. Renee. Oh, you're on mute.
I think Jen was before me.
Oh, I'm sorry. I'm missing hands all over the place. Jen.
It's okay. It's really hard as the person doing this to see when hands are up. So that's why I just left it up. And I don't want to beat the dead horse. I think looking at a different definition for assisted living, I do want to add, as also someone that hears from a lot of families do want a choice to have something like the model that Jen was saying, where they're in the community, they have like maybe an apartment and some supports to figure that out and looking at different ways to do it. So I also want to ensure, I think one of the challenges as families that we have is sometimes there's a lot of push where it has to be one way or the other, and really looking at what it looks like for all families. So some families do want an assisted living choice, and we want to ensure that we're not taking that choice away. And we all know that our values are not to create something that looks institutional, that is not within the state, but we also worry that we want things in place, because if it's not us in 10 years doing this, you know, we know everyone on this call, that's their values right now. We assume that's going to be the values of New Hampshire, but we want to ensure that that stays in place for the future. And I'm just really going to quickly say PDMS, I would agree with Pam, having it on both waivers, I think would be beneficial. And as far as supports for unpaid caregivers, I think that makes sense, but we would probably want it defined by the caregivers themselves. So how do we look at that and make that work?
Some feedback, yeah, as on all points actually, but you know what I'm hearing as well with regard to assisted living is carving out space for that choice, so long as it's a choice through the person-centered planning process and not something that's driven by other factors. That's great.
And just adding to that, Jessica, I think some of the concern is people don't, I think what families are really, what we're hearing from families is families are concerned that sometimes they feel like they're put into a choice because of funding or some other things that are creating it. So we want to make sure when we know what we mean by choice, but that there aren't other things that are influencing it. So if their choice is this, but funding says no, is that really a choice, right? So
Right.
I want to be clear on that.
And definitely one of the helpful aspects of kind of carving out specific services that might have been part of one broad service is being able to tailor that definition so that it does offer that choice, I think. And it's the right service at the right time for an individual who chooses that particular service. And excellent point around supports for unpaid caregivers and really making sure that within the definition we're providing additional information about who meets that criteria as a caregiver, who would fall under that. Great. Renee, I believe Renee.
I think I'm good. I think I'm good now. I agree with everything that everyone has said. And it's interesting to hear the points being made, because in looking at the assisted living category, coming from a long-term care background where I ran an assisted living facility for 15 years, I automatically think of the older population. So I do think that there is a need for that for our individuals who are aging. And it would be a really cool option to have, you know, assisted living facilities for our individuals as they age. I would love that. I think that would be great. And then I love Jen's idea, and Pam brought this up too. I think, you know, my thoughts on like what Jen wants to build is more of like supported living, where, you know, it's a step down from, you know, an EFC or whatever, where people are definitely more independent. They have, you know, maybe a little apartment and they have some oversight. So it's like a supported living model. And, you know, we at Easter Seals have had families that have come to us in like a group of families that have come and said, you know, we have 15 kids, you know, we want to put this together, you know, can you help? And I think the issue has always been that it's actually still pretty expensive to put it together. So the funding for supported living, you know, we think about our people who are in enhanced family care who would really fit into a supported living model, and their budgets, you know, we ran the numbers and their budgets just wouldn't cover it. It'd be a pretty big increase for them. And that's kind of not what we want to do. So there's got to be a way. And, you know, I'm sure Jen's probably working on it, and maybe other vendors are too, to figure out how to make that a viable option for people in New Hampshire, because it's super awesome if you can think about like an apartment building with people and just having staff check in, you know, teaching them public transportation, all of that kind of thing. I think that's awesome. But I definitely I would love to see if we could create some assisted living options for our elderly people with developmental disabilities, because it's needed. And, you know, we have we have, 4 medical model homes, and we know that we could probably pop up a ton more because we get RFPs for people that need that medical model. And not to say that the assisted living would be for those individuals, because a lot of them are still really young. But I can see, the assisted living model for our aging population being like just a really super cool idea if we can figure that out.
Yeah, absolutely. I agree. And it's,
and oh, sorry, Jessica.
No, please.
One
I
more,
was just responding to your thoughts.
yeah, one more thing on that same note. It would really be great, and I did put this as a comment, if we can determine how our individuals who are older can attend adult medical day programs, because we have medical day programs for individuals who are seniors, and we have seniors who have developmental disabilities who would really benefit from attending that. But that's supported by the CFI waiver and not our DD waiver. So a lot of, like, we have a couple people where we've done some waivers with the area agencies and we've made it work. I think Pam, we have someone that we work together on for that, to attend our adult day that's in Rochester. But, we have a lot of individuals that are aging and they would really benefit from adult medical day. Because what happens is people say they retire from their day supports, right? And then they end up being home with their provider or their family as an older adult, when they could really, really benefit from, being able to participate in that. It is facility based, so I'm sure, there's a lot of work around it, but it's really beneficial if you have an adult day that's working really well.
Definitely. And I think this is, excuse me, these are really, I'll just say, cool opportunities that we have as we look at what other services are available, what maybe service need gaps have we identified currently that we might be able to look at, services that are available that we might be able to build into our waivers. And then, as we separate and distinguish them, I think I mentioned this before as well, offering that as a service and a service array that someone might pick to round off the supports available, so that they're not choosing from what's currently maybe broadly defined services. And then making the best use of funds available as well, because part of the work that's happening in the rate work group really will be to look at the services and figure out, okay, what is the most appropriate rate to provide that service, and just making the best use of budget dollars. Any other feedback on the services that were defined as distinct to the two? Oh, there's bunches of it. Michelle and Tim, I'm not sure who had their hand up first. Michelle's at the top of my screen. Is that okay, Michelle? Go for it.
Okay. A couple of things, a lot of things that I wanted to say people have already said, so I'm just sort of going to jump off on that. As Renee was talking, the adult medical day popped into my head as well. That's why I put my hand up, because I think that's a huge need for folks. And I noticed a lot of overlap with what's already in the CFI waiver. There's a lot of services already similar to what we're thinking about adding to the DD waiver. So I thought that was interesting, and we should look to CFI, to see if we can steal some stuff, not reinvent the wheel. But also in terms of the assisted living, one thing that I have noticed is oftentimes there are young people with medical needs who end up in nursing homes with older people. There are people in their 20s and 30s who end up in nursing homes because there's no place else for them to go. So looking at expanding that option for people, I think is a huge need. And also for older people with developmental disabilities, they often don't fit into the current nursing home assisted living models because of their developmental disabilities. The facilities can't handle that kind of thing. So I'm really interested in looking at this model and expanding it as much as possible for folks. And then to flip back to the idea of the supported housing, supported living kind of thing, we might want to look at some behavioral health type services. Massachusetts, for instance, I used to work there, and I used to run a supported housing program for people with behavioral health issues. They do it. It's doable. People living in their own apartments with support. We actually had buildings where there was an office in the building and everybody had their own apartment and that kind of thing. So, you know, looking to, like we did here, looking at other waivers, maybe looking at other types of services as well to just borrow from them and not reinvent the wheel. I think
That's
my comments.
That's great. Actually, that's a really great idea for us to look into. I mean, as we start to kind of define the supports available, what are other states doing? How do they operationalize them? You know, how have they worked with and through certain regulatory barriers and things along those lines? Thank you for that. Tim.
Yes, thank you. Yeah, I would agree with exactly what everybody said. I mean, and I like what Renee said. Gateways has an adult day program for seniors. I think there's a lot of opportunity for the adult day medical model for those types of people that are on the DD side that would really help them as they get out of the regular day program traditionally. So I think that would be great. And as Michelle said, the CFI has a lot of good things on it that we should benefit. Assisted living, there's nothing wrong with everything. I've heard everything that's been very good. You know, there's a lot of people on the DD side that live independently that could use additional support. So anything that we can do to help them facilitate that lifestyle with assisting living and, you know, developing areas where the families would feel comfortable having their child age successfully would be great. On the PDMS side, I think it's what Pam said. Certainly both waivers that we have talked about would probably be the best fit for that. Again, it's about the complexity of the individuals, but I'm more of an operational side person. So every time I hear these things, I try and put it into operational side, but I mean, it might be dollar criteria that would dictate whether they're on the sports side. Once they get over a second X amount of dollars, they kick out over onto the comprehensive side or something to that effect. But so again, I think everything that I've heard is very appealing, and I think we just need to dig a little bit deeper. So thank you.
Thank you, Tim. And actually, that was some that fits with other feedback we received, maybe not specific to assisted living, but in general, you know, is there an opportunity to provide different levels? And if we do that, does that maybe determine whether a service that we haven't identified as specific to the comp or specific to the supports waiver, is that going to identify whether that service is provided within one or the other if it's offered on both? Really great feedback. Sarah.
Yeah, Michelle jogged my memory and folks talking about CFI. There were two particular CFI services that I had wanted to note, and I think I forgot to mention them in my workbook, but one was Meals on Wheels. I feel like that could be really beneficial for some of our folks who are living independently, and then also visiting nursing. I think that might be a useful service again for folks who are living independently. And it's a little different. The VNA services are a bit different than kind of the nurse trainer model that we have on the DD side. So some might benefit more from one than the other, or if there's any way to kind of synthesize both. I think that nursing piece might warrant a little more exploration. And I didn't see it anywhere in the workbook, I don't think, or the Meals on Wheels. So it might be worth kind of looking at those as waiver services too.
Great feedback. And I think that that's definitely consistent with additional recommendations that we saw within the responses, which is, you know, something that might be an all-inclusive service. You know, what are our opportunities to pull the different components out and make them their own services? So for example, if we're talking the residential model, you know, if we pulled out something like nursing, you know, in a different way than state plan provides, of course, medication management, personal care, you know, what are our opportunities there in developing that, still with residential defined, you know, similar but different to what we know it as now, and maybe more specific to the residential component of it. So yes, very awesome feedback. Thank you.
Again, those are services on the CFI waiver too. So it's again, kind of looking back at that CFI waiver and seeing if there can be some integration or usefulness.
Definitely, yeah. And are there opportunities where, you know, if someone is still seeking services under either the comprehensive waiver, the supports waiver, what are our opportunities as we build out these services with rates that are specific to individuals who might experience a disability. I think it was either Renee or Jen. Renee, I believe it was you that said, in the current assisted living model, there are challenges and barriers if someone is seeking to move to an assisted living facility and receive those additional medical supports. What are the barriers currently to being able to find a setting that the individual wants to move to, and what are the barriers when with some assisted living facilities maybe saying, gee, right now we don't have the capacity. What does that mean? And possibly something, notes that we could forward over to our friends at the rate work group as they build out their work as well.
Pam. Hi. I wanted just to mention it because I keep hearing the CFI waiver, and one of the things as I think of that is we've had quite a few people, even just recently, that they need exactly in between. And this is where we really make the choice. It goes one way or the other. The problem is if you go to the CFI, you may be getting more of the health and medical, and then you're getting none of the other that the DD waiver, ABD waiver, affords people. And then if you do that, then you have to really figure out how you're gonna, if they're not, for example, in a residential setting or something, you have to figure out how you get some of that nursing components, how you get some of the things that Sarah was talking, to come in and stuff. So it's also a lot of people that if we were able to do something, that kind of mixes that, you wouldn't have to go so far as to have people in heavy, more residential settings. People could be continuing to stay in the community. But I see that it's as long as I've been around, that's what I see, and more now, because and when something doesn't work out, for example, with the DD waiver for something, I can't tell you how many times I've been, told to go apply for the CFI waiver when their CFI waiver has nothing to do with what the person needs. It's just trying to figure out what you can do to help a person. So I think we just have to really take a look at that and see the people that are, it's again, those people that kind of fall in the middle, in between, and if we could just be able to do something in that middle kind of area, it would help, I think, for a period of time that people could continue to be in the community.
I think it's a really important point for us to consider as we move through the work as well. And what I'm hearing is really ensuring that what is created in building out these tiered waivers follow someone's support needs, so that their level of care, to use waiver language, but their support needs are what determine the most appropriate waiver, and maybe not the need for a service that's exclusive to another, but then the result is not having access to services within the developmental disabilities waiver that would be really beneficial to continue to live and participate within the community.
Yeah, it's almost, I think it's almost as if you're figuring out the need and then backing into where you need to go for the waiver or for the funding. And, that's a lot of times people get stuck in where it's going to go. So it's like, a lot of times I'll tell, my staff to just don't even think of that. What do we need for this person? And then you look at how you're going to get there. Because I think we're confined by, in some instances, how we're set up now. So we really need to have that flexibility.
Great, thank you. Sarah.
Just as we talk about kind of the different, the issues we have currently between the CFI and, DD waiver, and now talking about maybe adding, multiple DD waivers, I think we also have to look at how to streamline the process. If somebody's level of need changes, how do people move between these waiver programs? We helped somebody transition recently from CFI to DD. And she, remained in a very unsafe situation for many, many months while we navigated the logistics of that transition, and then ended up temporarily in a nursing home because still the transition couldn't be executed from one waiver to another. And so as we talk about kind of adding, another waiver layer of waivers on, I think we just have to look at, if there's an emergent change of circumstance or change of level of need, how do we expedite that so that people aren't kind of in limbo with their services? Because people's needs aren't static, and so somehow the movement between waivers can't be so rigid either. So just kind of throwing that out there. Probably not a small problem to solve, but
definitely important for us to keep in mind as we continue with the work, and certainly when we move into discussions about level of care determination and things like that. What would that look like? And ideally, what would that look like? And what are some of maybe the pain points of these as you've described right now? And is there anything that we can put within our waivers to assist in bridging that possibly? Okay, this is great discussion and I don't want to end it. Does anybody else have any comments before I move on? Okay, I don't see any, but just because I changed the slide, if something comes to someone, just speak up, raise your hand. So these are the results. Sorry, you guys are probably seeing this guy. These are the results of the remaining 75 services. So I think most people, and I believe I took the same approach with this assignment, said, yes, let's explore them, let's look at them. And this is where we tended to see a considerable amount of feedback around overlap, which I've referenced or I've made mention before. A couple of things happen there that cause that. One, service category titles don't necessarily need to be consistent through states. So what one state calls one service, another state may call another services. So our CSS, for example, had a different name, I believe, in the Connecticut waiver. And some of the responses did indicate that, like, gee, this really seems like CSS in our current waiver. The other thing is, again, as we've talked about, right now we have service categories that include multiple components that some individuals utilize all of those components. Some individuals utilize only a piece or two of them. Other states have taken the approach of separating the services out, as I mentioned before, something like residential, having something like nursing medication management broken out and personal care broken out. So these are the remaining services. So what we'll want to do as a group is really kind of focus on what are the supports, what are the commonalities between these services, and what space and where would we put them, which waiver, both waivers. And if we were to put them on both waivers, I think I've heard a couple of people say, does it seem most appropriate to maybe have different levels, and that determines what the support looks like within both of the waivers. And this slide is a lot to take in. One thing I will point out though is adult day health was brought up was noted as a service for both waivers that we should consider. Services for seniors, I think overwhelmingly the group identified and said, yeah, this is something we really want to explore. Maybe not verbatim as it's been defined in other states, but certainly something to consider and include within our waivers. Okay, so of these, I think I dipped into this content a little bit. So what we'll have to do is balance the two competing priorities when aligning the services. The more services we incorporate on a waiver, the more specific each service definition will need to be. There's some good and some bad with that. It does reduce some potential flexibility with services as noted, but it does allow for a more tailored service array within service planning. So 75 of the services, as I indicated, were put on both waivers. And what we wanted to really facilitate in terms of a discussion around this was, are there any overarching themes in certain types of services that the group was interested in exploring more? And I did hear that definitely loud and clear through our previous discussion around services for individuals as they're aging, or different opportunities for what a residential setting may look like. And modifications. Were there components and vehicle modification services that the group wants to bring forward, but that service might be able to be consolidated, or was an interest in multiple distinct iterations of the service? Another discussion point for us is, are we interested in breaking out some services? And I think it sounded, based on the last conversation, like that would be something we'd like to explore, to delineate service milestones into measurable activities that could have either unique service definitions, unique rates to incentivize service progression, and what are the benefits to unbundling employment-related services, and what are the cons? And then residential personal care was identified for both waivers. Is the interest of the group to keep out-of-home residential supports on both waivers, or is the interest in keeping residential supports for the comprehensive waiver, but including personal care on the supports waiver? So we touched upon that lightly in the previous discussion, but I think this is an opportunity for us to speak specifically to these areas. So any thoughts? Oh, Deb.
Hi, I just, looking at the previous slide reminded me that, as I went through the exercise and, trying to look at the definitions of everything, there's just so much overlap. And it seems to me that it would simplify things greatly and produce more flexibility, kind of what you've alluded to at the beginning here, by combining them and making the definitions broader, so that we're not looking at 75 different options. If we could whittle it down to 20 or something, and still be able to include all the services, but not name each individual little piece separately. That's all.
Yeah, absolutely. And I think to Krista's point earlier as well, having 75 services would also necessitate that we create 75 different provider qualification criteria points for each service. We have to indicate what the provider qualifications are. So thank you, Deb. I think Michelle was next. Go for it, Michelle.
Sort of to dovetail on what Deborah just said, there is a lot of overlap. I made a lot of notes that said, we already do this in this waiver. We already do this in this waiver. Like there's some employment stuff is already done in CPS and that kind of thing. So looking at where we already do stuff or where there's overlap and consolidating, I think is really important to make this less unwieldy, because it's really big. And then my other question was just, did anyone identify things to not explore? Because I know I did a few things, but it looks like every single thing has now been decided that we're going to explore it. So I'm just wondering what it looked like in terms of people saying, no, let's not explore this one or something like that.
Some respondents did have some categories listed as do not explore. Maybe they felt it was duplicative of something else, or another area might be if they noted some of the overlaps that you and Deb have both referenced. This sounds a lot like a service 2 lines above. They might have said do not explore to one, but maybe explore to the other, very similar service. If it was a service that was already provided for within our waivers, that was kind of a mixed response. Some folks said, gee, we already do this. Some folks said, yeah, I think it would be helpful to sort or to pull out personal care maybe from the service definition in and of itself for various reasons. So those were some of the reasons we saw do not explore in some of the times that we saw them. And I think to your point, Michelle, about combining some of the services, but then also kind of, as we've heard others say, looking at what makes sense to separate, what makes sense to combine and keep combined as we move forward, so that we're not offering 75 different things. And I'm just trying to think from an individual perspective, having 75 different services in front of me and offered, I can imagine would feel very overwhelming. So, I mean, making sure that we keep that in mind as well. And Deb referenced 20, that does seem to be actually a pretty common number across states and across waivers. I think even our counterparts over in CFI, I want to say it's somewhere around that number of waiver services, 15, 20, something like that. Renee.
Sorry, I'm talking so much.
No, it's
I also I agree with what's been said. And then one of the things that I think what would be not good is to reduce the flexibility, because one of the things that we as vendors have always said is there's no flexibility in that. There's no flexibility in CPS. And then, now we had flexibility through COVID with Appendix K, and we're like, wow, people have the best programs that they have ever had in their life because we've been able to be flexible with the provision of service. So, if we do separate this into 75 buckets, that's so hard to navigate, and it really does reduce the ability to be creative and to figure out what is person specific. So I hope that we're going to be careful in really being stringent about the definitions of these services and not allowing for flexibility when we're providing supports to people. So there needs to be some flexibility involved in the creation of their services. So that's just, when I see that decreasing the flexibility, that just makes me, cautious, because it's one of the things that we've enjoyed, and we've seen that it has led to quality improvement in a lot of cases.
definitely important points for us to consider as we move forward with the work. Keep that flexibility in options available for service planning and not reduce it in times of transition, and maybe looking at something different midway. And how do we what's that line where we're offering additional services that can be more tailored and not crossing into reducing flexibility. Great point. Sarah.
I wanted to speak just a little bit to the last question about kind of where ResHab fits within the two waivers. And I don't feel like we can really answer that yet until we do a lot more defining of kind of what exists under ResHab. Like, the word residential just means so many different things within our current waiver. It means different things to different people. I think we need to look at what types of living situations are available through the waiver program, and then kind of where do those fit within the two waivers. But I don't think we can really answer the question about, whether it's personal care or ResHab, when ResHab still means so many different things. I think we really need to kind of pick that one apart a little bit. But I also don't think that we can make the assumption that everyone on the supports waiver is going to be living at home with family. So in terms of out of home, I think there need to be some out of home options, but out of home doesn't have to mean a group home. And I think when you say residential, that's what comes to mind for a lot of people. So what, in terms of living arrangements, what variety of living arrangements can exist within these two waivers, and then which ones fall in which bucket, or within both. And I think that's the work that kind of needs to happen around the residential services to demystify some of, kind of how that works now and how it could work within the new system. I just think there's a lot of confusion within that piece.
That's an excellent recommendation. Thank you, Sarah. Any other thoughts from anyone on any of these general topics? Any of these topics?
Jessica, I just want to add, I completely echo what Renee said about if we're adding too many things, it's going to actually make it less flexible and less creative. So we do want to be careful of that. So I completely agree with what Renee said.
Okay. Thank you, Jen. Okay, anyone else? Okay. All right, so of those 75 services, still talking about those, remote support services were identified for both waivers. And this is a good, so we want to dive into this a little bit more, similar to our question about assisted living, and just trying to figure out, is everybody thinking of remote services as the same thing? Is the interest in keeping this as a defined service in and of itself, remote services, or as a service modality, similar to what's available in the Appendix K, or through the Appendix K right now? Thinking about the service delivery during the pandemic? Are there services where this has been more successful or less successful? Is also a point that we'd like to open up to the group. Excuse me. Also, some services were identified that are group-based, like group day supports for both waivers. And we wanted to open up a discussion around whether the group sees this as having different differentiations based on group sizes, small groups versus large groups, and how would those groups be defined? And then lastly, around shared living, it was identified as a service that seems like it may benefit from tiers or levels. And I think we've heard from the group that we do agree, but are there any other services that come to mind that might also benefit from having tiers? And then what do we as a group think about would be a good mechanism for defining and identifying tiers? And Sarah, I think your point definitely is well taken here in regard to this discussion as well, really jumping in, looking at different, what does residential mean? Let's look at that and, you know, talk about that and maybe use that as an activity. And there are specific groupings, extensive medical supports, extensive behavioral supports that should be considered. Anybody have any comment? Oh, Pam?
When you were talking about the remote services, I think you were talking about modalities. I think remote services, I think you have to be able to utilize it throughout whatever services are going on. I think what we found is for some people, I know that we got more participation, more connection with some folks that we hadn't had before. We didn't know that was going to happen, but we were pleasantly surprised. And for folks, in some instances, it were people that had I can think of a few people that had heavy duty behaviors. We were trying all of these different things, and we thought never will they in a million years be able to do remote. It was fascinating to see how well they did. On the other hand, you have other people that absolutely couldn't in certain situations. So I think you have to be able to utilize this throughout the services we have, not as a service, but as a modality for any of the services we offer. And I think the only other thing that I would like to say is about the service levels. It's interesting because as we talk about service levels, I have initially thought, oh, we have them. Well, for years we've had them where they're numbered 1 through 4, 1 through 6. And if somebody says, what does that mean? You can't define it. And so we have to have some way of defining what these levels are and what they specifically mean. However, again, we need flexibility, because where we run into problem is when we define them so much, then we end up with people that do not fit in those. And then we're really thrown off, and we can't figure out how to get, fit them in something. It shouldn't have to be like that. There should be a way to be able to move from one level to another in an easier fashion than we're able to do right now.
Thank you, Pam. And kind of jumping back to the discussion about remote services, did you find that for folks who maybe didn't find success or didn't enjoy participating in services remotely, were there specific services that seemed to yield that result, or was it more based on an individual and maybe what their goals or desired outcomes were from the service?
I think it all depends on the individual, because, you could take a look at anybody and think that, oh, it's because it was day services, or it was because it was, I don't know, something else. But we were doing things, and I know a lot of people that are on here, we're doing things, everything from, some sort of recreational type, to some of the goals and objectives and other things, all different types of activities. And I think it runs the gamut. I think you have people on all ends. So I don't think there's any real specific, just one group. I think it really does matter, looking at each individual.
Great, thank you. Deb.
Yeah, I was just going to say basically similar to what Pam said, the remote service should be a modality, not a distinct service, because it can apply to so many different services. And then in terms of the next point, group day services, I think there's value to doing things in a group sometimes. You know, lots of us, you know, go to exercise groups and, you know, support groups, and, you know, there's lots of usefulness in groups. There's also naturally lots of things that people want to do by themselves, but I would support having some option for group day supports. That's all.
Thank you. Jen?
Yeah, so I completely agree with Pam and Deb on the remote services. You know, specialty services were huge for us in order to provide remote services to people in different services, res, day, and employment. I just wanted to throw out working in different states. Maine just developed a service called community membership, which is very similar to the group day support. So that could be something we could look at. I know it wasn't on our service offering, but it definitely speaks to that. And then of course, with shared living, we have to look at levels and flexibility.
Thank you, Jen.
Jen, is that like more of like a facility-based kind of day with some outings in the community, or what does that look like, the community membership?
It's all in the community, so you can't be, you know, in a like a setting or a residential setting, but it's all community-based with a group, sort of like a 1-to-2, 1-to-3 ratio. But it provides flexibility, and you can provide the day services and then do 20 hours of community membership. So I think that would be something we want to look at, you know, if we kind of look at our CPS and combine it. So just a thought, it was interesting, and I can certainly send info out to the group.
Thank you. Does anyone else have any? Oh, Michelle?
Yeah, just in terms of the group support thing, I had actually made a comment that in light of the staffing situation, I think we really need to look at group. You know, I obviously don't want to go back to shelter workshops and, you know, that kind of thing, clearly, but what are the flexibilities that we can provide around group things to help with the staffing shortage? I mean, we get one-to-one community supports just they're not happening because we simply don't have the staff, and I don't know when that's going to change. So we need to seriously reconsider how we do our day services to make sure people are getting supports and services with the limited staff that we have. So just sort of a soapbox kind of thing. So
no, I think it's important feedback that everyone's sharing too, and where we're looking at what are our opportunities to kind of, you know, separate, maybe not separate, but define specifically something that might be included within CPS, but not quite. This is an opportunity where we would want to add flexibility by pulling a service out, add flexibility in terms of someone's planning options. So great feedback, everyone. This is awesome discussion. Pam.
I think I just want to reiterate what Michelle had said. I think that absolutely with the staffing, I think we're all in the middle of it, and there are ways to do the groups that can work on skills for individuals. It doesn't have to be everybody's doing the same thing. I mean, there's so many different ways of doing it. And I think we learned as we had to pivot to remote and do all the things because of COVID, that I think we really need to look at it. Of course, on the other end, I think the piece that some of the folks that are out there, for example, in community support services and that are out there needing those individual, people to be out there, and we don't have the staffing. That's where, in some instances, remote has helped us. So I think you really need to look at all of these things, and I think, as Michelle said too, as a caveat to it, is nobody wants to go back to, the days of old, so to speak. We're not talking about, when you talk about group, I think Deb had a great, how she was talking about, we all do things in groups, that's also how you meet people. That's also how you make connections. And so I think we really have to look at some of these in different ways and really incorporate some of the things that we've all learned over the years, and not have them separate from one another. It's all a part of, people being able to integrate into their communities and not separate them out.
Excellent feedback for sure. I mean, I think that point was well taken. And I wrote it down as well. I mean, how groups can offer, in addition to the service at hand, just natural peer support and, community gathering, and, ensuring that as we look forward and look at the different services that we include, to also ensure that we're upholding the values and the tenets of home community-based services as well. Thank you. Krista.
So I want to recognize, of course, the workforce shortage and acknowledge the benefits of group participation. But I just want to say, I don't think that we can use the staffing crisis as a rationale for using a group situation for that kind of support for individuals. That's a real concern for me, to say that that's a reason to use group support. I think certainly using that when it's appropriate for people, but making sure that the rationale that we're using a group support is that it would really benefit the person that's participating in it, and not for staffing reasons.
Thank you, Krista, for bringing that point and just ensuring that we keep that at the front of all of the supports that we're considering as we move forward. Deb.
Yeah, I was just going to say, similar to the point above, I don't know that group day supports needs to be a particular service, whether it's individual or group. Can't that be considered more of a, I don't know if modality is the right word, but I don't see the need to list it as a distinct service.
Yeah, I think as we kind of move forward and look at them, a couple of points for all services and not just group day services that we'll consider is, would we be able to define the service with a broader service definition, and also provide provider qualifications in a broader definition? And then, of course, for the other end, in the reimbursement of services, would we be able to identify that rate if the service itself was specific to individual and group? And I don't necessarily know the answer to that, just, some things that will be discussed for sure as we narrow down the 75 services and move forward with that work. Jen.
It would also,
I'm sorry, Deb, go ahead.
I'm sorry, I was just going to continue and say it also provides more of that flexibility if it isn't a distinct service, because if it's a distinct service, then you say, okay, 10 hours a week are going to be group day supports and 20 hours a week are going to be individual. Then there's no flexibility to change that easily. Mm-hmm. And maybe there's a opportunity for a couple of people who enjoy doing the same things to get together and do it as a group, but they can't because they're on two different services. So that makes sense.
No, it's a great point. Thank you. Jen.
And I just want to follow up kind of similar to what Deb was saying. I think one of the things that we see oftentimes now is we all understand like having a group setting, and we you know, again, we go back to our values of not wanting to create an institutional thing, but I've heard time and time again from families, like one thing that the person that they love wants is to hang out with people like them. And because there are rules that people that are supported can't do that, they're not like, they may need a support person to go with them and do that, but then they're considered to be congregating when really they're just hanging out. And part of it, like I understand the reasoning for it, but on the other hand, we're taking choice away. And we've heard this at Family Voices from family members, from the youth themselves, that creates a barrier that is unintentional. That is not what we're requiring. And I will go back to, I am a family member. I will say most of my friends are people that are peers that are kind of in a similar situation to me because they get it. I don't have to explain it. I feel comfortable. We can be that way. So I also want to ensure that, you know, we're not, you know, taking the workforce shortage away. Like if someone's supported and they, like 5 of them want to get together and hang out, that's their choice. They should be allowed to do that. And we need to make sure we're not inadvertently taking that choice away because we have a different opinion of what it should look like.
Excellent point, Jen. Really consistent with feedback that we received and heard several times throughout public comment as well for the DD waiver when it was renewing. Sarah.
Just kind of piggybacking off of what a lot of people have said about the day supports. And, you know, I think part of where we trip ourselves up is on how we measure community participation. I think we, you know, currently we measure it by physical location and like number of people that you're with who do or do not have a disability. And somehow we have to figure out some objective quality of life metrics to measure community participation that aren't so rigid, because you can be physically in the community with an individualized support and still have it be relatively meaningless. So, you know, we need to figure out how to assess for meaning versus just physical location and kind of who you are with or not with. And so I think that's part of beyond just kind of the service definition, you know, how are we going to measure that in a way that's objective, but allows all that kind of flexibility that people are talking about and isn't so rigid in terms of, you know, kind of how do we define community and how do we define community participation?
Absolutely. I agree with you, definitely. What is the definition of community? And especially as we've seen it over the last couple of years, but even maybe over the last 15, 20 years. And, you know, also what is the definition of meaningful and how, you know, how is it measurable and what does even that mean? So great points. Thank you. Renee.
So I guess I'm just wondering why we need something that's called group day supports when we are already afforded the opportunity to create schedules like this and budgets that are individualized for people to have that participation in their individualized schedule. So, you know, if the ISA, you know, has an updated schedule and people's budgets are written so that it reflects what the participation is, I guess I'm just not understanding why we would need a separate category for group day supports when if you're individualizing a program, you can create the schedule, create the budget and do that. Now, maybe that will change with the rate setting committee and maybe, you know, what their work, maybe there won't be, because I think that they're looking, and I could be wrong, but they're looking at kind of creating, you know, level systems for rating. And so maybe the flexibility of the services provided in an individual budget will change. I'm not sure. But, you know, if you have someone right now who wants, you know, one day they participate in activities that are structured with a group of 2 other people, and then on another day they work and they need one-to-one job supports, you know, you can do that now. You can create that individualized program for someone now. That would include some group supports. So I guess I'm just throwing that out there. Like, does it have to be something that's labeled group day supports when we have the flexibility to do that already within CPS?
Excellent points for consideration as we move forward, definitely, you know, and I think as we move forward in building the service definitions, to your point, there could be some you know, things for in terms of how to operationalize them that drive some of the work. Also some of the assurances that we provide to CMS when we submit the waiver for their consideration may drive it as well. Not just in provider qualifications, but, you know, different aspects of it in, you know, ensuring that the program is community-based and meets the criteria outlined for home and community-based. So, you know, it'll be great for us to keep that in mind too, Renee, as we consider how do we ensure that we're not limiting flexibility as an unintended consequence of separating things out. Any other conversation or feedback on these areas, or even any other area that you saw within the assignment last month that we want to bring forward? Okay. Okay, so we're going to shift gears just a little bit to the survey. So a few things, even within this conversation that we've been having, that we've heard in the last group, is flexibility, efficiencies, different innovations that have been created in general through the public health emergency and the COVID-19 pandemic. And what we'd like to do, and just brainstorm with this group right now, is how do we, you know, get that information and capture that and see if that's something that we could, you know, that we may have the opportunity to memorialize within a waiver. You know, remote services, for example, we definitely heard in multiple groups that they've been really beneficial. They've really enhanced service delivery and really helped individuals feel more success in working towards goals and desired outcomes. So if we were to send out a survey, what we'd like to know is, you know, what group should receive the survey and what specific information is important to gather. And we've offered some suggested or, you know, questions to consider for providers and for families. And we do plan to distribute the survey anonymously first and electronically, with primarily open-ended questions, and any requested changes to this process or focus either. So what do we think? So let's tackle the first one first. What groups do we think should receive the survey? Oh, Krista.
Did you say you're going to distribute the survey electronically?
It does look like that is the goal, the primary distribution method.
So I'm just wondering about people in the state that may not have computers or access to internet, how you're going to capture data from those that group of people.
Okay, great. So we'll want to definitely create a plan to reach individuals who either don't have access or maybe that's not their preferred way to go about completing a survey. Thank you.
I think it's also very hard to capture data if you're asking open-ended questions. I'm not sure how, you know, would someone have the time to go through and, you know, read all of those answers and then categorize them, or would it be easier to I'm not sure. Like we are really outcome focused right now at Easter Seal. So we have a business analyst, and so she's trained me to say, you know, Renee, you can't put something out there that's open-ended because I can't capture that data. Like it almost needs to be where something where you maybe have some answers and then maybe allow for comments. I'm not really sure. I just know that if she were in this meeting, she would say, no open-ended questions, because she can't capture the results.
Okay. Thank you. Anyone else with groups? I know a lot of you sit on various groups. Oh, yeah, go ahead.
Yeah, I was just going to say, following up on what Renee said, you know, giving, you know, kind of multiple choice, you know, but check off as many as apply, You know, just, and you could always put an other in case somebody came up with something that the people making the list didn't think of, but the vast majority would be easy to do data collection on that way.
Excellent, thank you. Pam.
I think the one thing I just want to say is that I think this is a great idea, but we have to be really careful. People have been inundated with surveys, especially during this time. I think I've heard of a number of agencies that have sent out surveys in regards to whether about the remote, whether going back, you know, coming back into services. I know for the waivers, you know, we had people being asked to, you know, give information on all sorts of things. I think people get inundated with some of these things. And also, I think people also, we continue to ask some of the same questions and some of the same things. So I think you have to be really clear what this is for and why we're asking for it. And is there really going to be changes that are coming from this? Because people don't want to keep answering these surveys and questions about some of the same things we've been talking about for years. And I mean that in, you know, in certain ways, there's been a lot of changes, but I think there are some things that are still that we always talk about. And so I just want to throw that out there. Again, I think it's obviously a good idea anytime when you're talking about any of these things. And as Krista said, I think it not only has to be electronic, we've got to have a way to get it out to people that, you know, don't have the ability, or it's not a preferred, you know, way of getting information. So again, I just wanted to just throw that out there, that people just, it's a lot sometimes.
Thank you, Pam, but great points, especially in terms of us in a group and, you know, holding ourselves to the requirement, you know, the unspoken requirement at this point that the data that we get in, that we ensure we're utilizing that as we move forward, you know, and looking at opportunities and things that we might be able to memorialize. Krista.
In looking at the questions more, I just had another thought. It does say for providers, for families. It doesn't say for individuals that are receiving services, so that might be something to consider. And then just looking at the language in the questions, thinking about plain language, thinking about the language that's used there. So that you can more easily access the questions.
Thank you very much. And I think to your point and Pam's as well, and thinking about groups, and if people aren't thinking of groups right off the top of your heads, please feel free as they come to you to forward them to the BDS, the survey, or excuse me, the work group inbox, and we can take that information there in that way as well. Jen.
And you may have said this, Jessica, and I'm sorry if I missed it, the time frame on this survey, because I'm also thinking, looking at people doing a survey, if there's a way to go into groups, so like State Family Support Council, you know, People First, things like that, because they're going to have probably a little more success actually going into the groups. However, if we're looking at having this done by like, you know, mid-January, you know, depending on timing, that's going to be a challenge because most people have their agendas already set, and are willing to be flexible. But I do think you might get some more bang for your buck kind of going into those groups and having them answer some of the questions.
Great. And if it is there, so part of one of the things we can brainstorm here as a group too is what would be the best timeline or the best time frame to introduce something like this.
I know someone mentioned kind of survey fatigue. And I should know this, but I don't. Right? We're getting ready to do the national core indicator surveys. I think this is going to be tough.
Thank you. I'm actually making note of that too as we look at the time frame. Tim.
Yeah, it's just the word anonymous survey kind of, maybe I don't understand what that means. Shouldn't this be from whatever we call our group, the BDS System Work Waiver Group? We're trying to improve the system and your input is valuable instead of this anonymous survey. I think that you want to emphasize the importance of gathering this information, that it will be used and put to use. I know Pam had earlier said, will people answer this and those type of things? But I think if you say we are working on the waiver to improve the waiver for your benefit, any input that you provide will be, evaluated and incorporated into, the future. So I think the importance of the name of the group or whoever it comes from should be the emphasis of it and not anonymous.
Great points there. And I think it'll be important for us on that survey to clarify and state who is providing the survey, and just that the responses in and of themselves would be anonymous to facilitate and encourage people to share thoughts and opinions.
I absolutely agree. I think people are getting so many weird things on email that, click into this and click into that. And I just did that and my credit card got stolen. So, I mean, it's like,
ooh, yeah,
you just don't even know what's going around out there. So like if I got something anonymous, I wouldn't do it. I would just delete it because I would not know if it's a phishing email or they wanted credit card info. Yeah, my Easter Seals credit card got stolen. The number got stolen, and I bought a lot of pizza at the Fargo Pizza Ranch in North Dakota, as well as a inmate jail pack for someone who is in prison in Missouri. So it's really random, but they figure it out. These guys, they figure it out.
Good point. We don't want our survey to go directly to spam. I do believe the intent is to distribute it either from our inbox, our BDS survey work group or Waiver work group inbox, or from, the group in general, and not to distribute it from an anonymous source, but to encourage them to just reassure respondents that if they wish to remain anonymous, that we will keep those responses just within our group, and there won't be a way for us to determine, oh, gee, Jessica, this is her response right here. And I'm sorry to hear that that's going on with the Easter Seals credit card, Renee.
Oh my gosh, it's so random. I was like, what is that? I know that, just another point, and then I'll stop talking. I promise. I know I'm taking up so much of your time. If you, in thinking about these questions and trying to determine the multiple choice answers and everything that could come up as a response, it's almost like you need to have another meeting to sort of talk through that, because like, that's what we kind of do. Like our business analysts will hold a meeting and say, what are all the potential possible answers that people could have for some of these questions? And then you just do sort of like a group think and put together like, what are the possible questions? And then you come up with as many, things that you think might happen or might be as a response. And then you do have that other line, like was mentioned before, where someone could write something in, but it's almost like it's a long process to kind of think through what are all the possible potential answers that someone could have. But it's something that you do as a group, and if it's well thought out, you'll hit on everything.
Definitely agree. Yeah. Thank you.
And Jessica, I think you asked as far as time frame. So I'm thinking of some of the groups I'm involved, like the State Family Support Council. We don't meet again till February. It's difficult to get us in the middle, and that gets typically all 10 area agency council representatives there. So they're the beginning of February. So I know that's a little bit out. We could try to get them earlier. But looking around, like maybe starting it, but having a little bit longer time frame so we can ensure we're getting whoever we want or are aiming for in that group. So there are a lot of groups that meet kind of bi-monthly. So, working around those schedules.
Okay. Thank you. Okay. So we'll bring that back definitely and take a look at how we're sending the survey out, ensure that the plan is to send it out from our waiver work group and really, you know, list in there what the intended use would be. Look at the timeline for sure, make sure that there are other options besides just electronic in terms of completing and returning the survey. And we'll try to get that information back out to everybody as we brainstorm, you know, this process, because I think really what we want to be able to do is find, you know, the least intrusive way possible to tap into some of the innovations that have been brought about and see just, you know, we've, like I said, we heard from multiple groups that GE remote services, there were different flexibilities that came about through the public health emergency, just made such a difference in individuals' lives and service provision. You know, what else could be a possible outcome or focus that we could include within our waiver services as we build them out, and you know, make sure that there's not something that's great and just that's worked so well that we're missing or not considering. Any other feedback on the survey for now? Okay. So next steps, I am excited to announce that there is not an assignment for this month. Yay. Just with the holidays, et cetera, and we know folks may be out or have other focuses, and we want everyone to enjoy time with their family and to relax. If you have any substantial edits to your November homework assignment as a result of today's conversation, please feel free to resubmit your workbook with the updated information. I think there were definitely there was a lot of discussion around the services, a lot of clarification shared from group members about what they had in mind as they looked at something. And we still encourage that, or if you've, you know, not had an opportunity to look at that workbook yet, and or maybe look at it, but it was a very sizable document to go through and definitely required an amount of time for sure to process all of it and provide feedback. We're still welcoming that information to come through. Our next meeting right now is scheduled for Tuesday, January 11th. And that will be after the new year. So any other thoughts as we close the meeting for now? Any other questions? Stop share so I can see everyone.
Sorry, Jessica. I put the next meeting date on closed caption.
Oh, I'm sorry.
Sorry.
So thank you. What is the next meeting date?
I put it as the date the homework was due.
So the first full week of the month, I am seeing January 4th would be our next meeting then.
I'm fairly certain that the 11th is correct because we pushed back a week given the holiday week. So I believe we should all see one another again on 1/11, and we'll be in touch if there's something wrong with that.
Thank you, Alicia. Krista.
So last month, my understanding was that you were going to be looking at DSP requirements from surrounding states. And I'm wondering when you're going to be reviewing that with this group or providing information to this group about that.
Yes, Alicia, correct me if I'm wrong, but I do believe as we're still continuing to compile it, we really wanted to make sure that we had all the data available. So our goal is for in January to present that information.
That's correct.
Okay, thank you.
Thank you, and sorry for not updating the group on that right off the bat. I know that was an expected and anticipated topic for this month's agenda. Any other questions from the group? I just want to thank you all. This was an excellent meeting and really great conversation and dialogue around the very many services that we looked at. And I think really important as we consider what are those services that we want to include moving forward, what are our opportunities to add services, things like that. So the responses from the homework were great, the notes were great, and just great conversation. So thank you all. I hope everyone has an excellent holiday season, and I look forward to seeing you all again next month. Bye, everyone. Take care.
Yes.